had a message from somebody asking if I would do a video on OCD. So if that's something that you're interested in learning more about, please keep watching. So today I'm going to talk about OCD, Obsessive Compulsive Disorder, and something else that is similar to it called Obsessive Compulsive Personality Disorder, also known as OCPD. So with the OCD, what this really looks like is very anxiety producing. It's very distressing for people. It causes a lot of impairment in their day-to-day functioning. And if we're looking at the classification of this particular diagnosis, it would be under the anxiety disorders. And obsessive compulsive disorder really looks a lot like rumination. So the same kinds of thoughts over and over. It looks like maybe having an obsession with numbers or repetition. So maybe you have to tap your foot 5 times in a row, a certain number of times in a day, or maybe it's washing your hands a certain number of times during the day because you're so scared of germs. It could look a lot like I have a really hard time leaving my house because I have to check to make sure that I turned off the stove. And not only do I have to check to make sure I turned off the stove, I have to go back and check again. And then I'll get in my car, but then did I really check the stove? And then I'll have to go back and check it again. And these kind of behaviors are really ego dystonic, which means that the behaviors that you're doing are not synonymous, or they don't feel right with your worldview and your perception. So basically they're going against how you really feel. You know that they're causing you distress, but you still have this compulsion to do them. Now, the other type of OCD is the OCPD. And now what I want people to understand is that there is a distinct difference. So the OCPD, Obsessive Compulsive Personality Disorder, because everything has to be a disorder, right? If we were to diagnose this, really OCPD looks like, for lack of a better term, what I would call being anal about organization, right? Perfectionism. So these are the people that are really perfectionistic. They really want things to be in a certain way in their home. Maybe their dishes have to be stacked a certain way. Their books all need to be alphabetized and sorted by height, right? Their DVDs, if people still have DVDs, all need to be alphabetized. Your closet needs to be color coded, and you are very rigid. So the key word here is rigidity of your beliefs. And for these people, things feel egosyntonic. So instead of things feeling distressing for them, things feel right. So when they are engaging in this behavior, it's just who they are. It's part of their personality. And if we could really notice when we're just throwing around the term OCD and not being flippant about it, because if somebody's saying, oh, I organized my closet and I color coded all my clothes, and then I organized by type of clothing and it took me 2 hours. Oh, it's so OCD. You're probably not actually OCD. It's possibly OCPD, right? The obsessive compulsive personality aspect of it. And disorder isn't really a word that I like to use, so I'm just going to say type, personality type. What I want to make clear is that just because you maybe are leaving the house and you need to make sure that the curling iron's off, so you run back in to check it and then you leave the home, it doesn't mean you have OCD just because you have concerns about your safety, right? If you're going to bed at night and you make sure the front door is locked or the back door is locked and the windows are shut, that's a general healthy safety concern. You want your house to be secure. If you crawl into bed after checking things and then you think, wait, I did check the back door, right? So you go to check the back door once and then you're done, you go to bed, you're probably not OCD, right? There's a spectrum of obsessive compulsiveness. And the same with the people that may have the OCPD. So just because you like to categorize your books, like I do on my bookshelf, my books are categorized by subject, and I also try to categorize them by height. That doesn't mean that I have some sort of disorder with obsessive compulsive personality. It just means that I like to organize. And I've had people come to me wanting to know, should I be distressed about the fact that things have to be organized a certain way in my home? And a lot of the time, it's just the way people are. And it can actually bring people joy to just be perfectionistic in some way with how they organize and categorize, but it doesn't have to be a disorder. Or if it is, it's not causing them distress. What we're really looking at, again, on this spectrum is just the amount of distress that it causes you. And oftentimes, if you have traits of OCPD, it may not be causing distress. And if it is, it could be causing distress, maybe if there's issues coming up in your marriage with the way the home is organized, or if you are at work and maybe you're organizing files or the supplies in a way that you have been told not to. Your boss wants it done this way, but because you are so rigid and you believe it should be done this way, that could be seen as an impairment, and it could be something that could be worth looking at as far as, well, how can I change this aspect of this personality trait that I have so that it doesn't cause as much impairment. A trick or a tip for people that do have the OCD where they feel like it's distressing and maybe they're having trouble leaving their home is making sure, here, I'll give an example. If you are checking to make sure the oven is off or the stove repeatedly, and you are having trouble leaving your home, one thing that you can do is maybe take a sticky or a piece of paper, and you can actually write on there, checked stove, stove is off, and take that with you. So that when you get in the car and then you start feeling this anxious compulsion to go back in the house and check again, you have it written down in front of you as tangible verification, because you wouldn't have written it down if you wouldn't have done it. So having something tangible that you can look at can be helpful for people that are engaging in these obsessive compulsive behaviors, because unfortunately, it just continues to solidify that cycle each time you go back and recheck, each time you go back and wash your hands. So being able to break that cycle in some way will help to decrease the compulsion to engage in these behaviors. So hopefully that is a tip, something that you can try if you struggle with OCD. So that is what I have for today for the difference between OCD and OCPD. I am enjoying hearing people's suggestions for things that they would like to know more about. So please feel free to shoot me a message if there's anything else you want to learn about, and I would be happy to talk about it with you. See ya.